Okay, good afternoon. Can you see my slides?
Yes, doctor, we can see.
So we've had sustainable development goals under Dr. Navarro, and this is an outlet will be laying the foundation for the rest of the school year with this lecture on public health. And why do we have to learn the framework of that public health is using, what it is, and why should you care? Why do you think, especially with the advent of this pandemic, why do you think public health has been pushed to the forefront of healthcare more so than your mainstream, which is your hospital-based healthcare, wherein patient goes into the hospital, comes for treatment, gets prescribed with medicine, etc., etc. That's how healthcare is usually perceived by a lot of people. But why is public health at the forefront right now? Anyone? Can you answer? Sharma, Vishmanu.
Yes, doctor.
Yes, why is public health important? Why do you think?
It's related to community health, ma'am. Okay.
It looks at, it tries to provide help at the community level. What else? Some other, wait. Priyadarshini, Sivakumar. Priyadarshini, Anasuri, Saisandip. Any opinion?
Can you repeat the question once again, please?
Why is public health, why do you think public health is important?
Public health is important because there are many lives which are deemed to live. There are rich and poor who can get a medical health care. It's important because if any problem arrives, they can have some treatment going for them.
Okay. So we solve important problems of health. Okay, what else?
We can also prevent the traditional methods, doctor.
Okay, we prevent diseases before its onset.
We can also stop such diseases. We can control them.
Stop, control disease.
Yes,
So
yes,
that is all encompassing in the role of public health. All right. Okay. So clinical medicine, as we know it, okay, we diagnose symptoms, we enhance capacity to function, treat disease, relieve pain, provide comfort. Okay, that is clinical medicine as we know it. You have learned it in your second year and continuing to learn it under your clinical subjects for this year. Okay, but using the public health perspective, okay, we implement and evaluate strategies that are population-based to promote health and prevent diseases. So these are not limited to people who are in the hospital. So what are population-based strategies? For example, to prevent motorcycle accidents or to minimize motorcycle accident injuries. What are population-based strategies? So for example, there are policies that you have to wear a helmet if you are riding a motorcycle. That's a population-based strategy. So these strategies promote health and prevent disease in different ways. Okay. Helmet law, so that's encompassing. So you have public health laws which will help promote further health of the people. For example, no smoking in public places. So these are laws and that are developed to promote health. Sugar tax. This is tax increasing the tax on sugary foods. Same tax, increasing tax on alcohol consumption, alcohol and cigarettes. Okay. So we assess and monitor health problems. Never has been more evident in monitoring how coronavirus is day to day. Every day we see cases. So you have learned surveillance in your early lectures in first year, how to monitor, and we will see that eventually in your later lectures as well. So assuring the provision of essential health services. So these health services, health systems, okay, some have broken down and some are barely getting by. So we have to make sure that our health systems would be capable of providing essential health services to our population. And that is the concern of public health. Okay? So by definition, it's the science and art of preventing disease. So your classmates are correct in their answer. Prolonging life, promoting health and efficiency through organized community efforts. For different reasons or different aspects: environment, community infections, education, medical and nursing services, social machinery, which will ensure standard of living so that every citizen would be able to maximize health. So organized community effort, prevent disease, promote health. So it is a melting pot for a lot of disciplines such as your epidemiology, research, family medicine, and your other clinical practices. Organizational-wise, this is the framework that public health uses. So it will be both formal structure of the government, so that is your local government unit or whatever is the department that would be assigned or be at the forefront, or a private or voluntary organization such as your non-government organizations who push for certain advocacies. What are the non-government organizations that you know of? Red Cross, Doctors Without Borders, and the like. Okay. Its mission would be to fulfill society's interest in assuring conditions in which people could be healthy. And the obligation of the agencies responsible for population-based health is to prevent epidemics and the spread of disease. If there is an epidemic such as what we are having, control, protect against environmental hazards. So these would be your protecting against climate change, natural disasters, etc. Prevent injuries, motorcycle injuries from disasters, occupational injuries, etc. Healthy behaviors and mental health. Okay, we have to take care of not just our physical makeup, but also our mental makeup as well. Healthy lifestyle, healthy behaviors, disaster response, and assist communities in recovery, and quality and accessible health services. Of course, we want healthy people in healthy communities, because if you are ill, you cannot be a productive member of society, or your capacity will be limited. Okay, again, promote physical and mental health, prevent disease, injury, and disability. Okay. So this one, it's nothing new. So this one would be Panacea and Hygeia. These are Greek gods that represent healing and health. So Hippocrates urged physicians to pay attention to the environment, social, and behavioral context in which illness occurs. So even before Hippocrates, we have the Hippocratic Oath, lived long before, and even then, he has said that we do not limit ourselves to treating disease only. Remember your biopsychosocial lectures. Remember, you have your bio, you have your psychological component, you have your social component, etc. So you have to look at all these things. And that is where the basis of public health will come from. So this one, as early as 1869, all governments protect life and health of their people. So corporate responsibility for the welfare of their people. So even laws would be made to protect life and health. Historically, so even before early 20th century, supportive relationship for public health has been there. So professionalization and practice because of the emergence of infection. Okay. Post-World War II, there are separation of the different countries so that we have to face another problem to manage care and cost. And of course, after the 9/11, there's a different understanding of your public health. So this is the historical context of it. So why should you care? So especially as medical students and eventual public health practitioners or medical practitioners, it's our duty and obligation to report certain conditions and cooperate with authorities. So what are reportable conditions? Okay, diseases of public health importance. You have to report when you see one in your clinic. So for example, your coronavirus, you have to report. Okay? You have your BHERT for the Philippines. So that's our contact tracing because you have to quarantine. Okay. Help get individual patients services they need. So in this pandemic, the health solution was the one hospital command. Although some will say that it's not effective because it's hard to access the number, and it just goes to show how in demand the number is. So more often the call is hard to get through because a lot of people are accessing the number. But that is a way to help get individual patients the services that they need. Help improve legal, financial, and social environment that you work in. Okay? So it's not just only the health situation. Of course, there are other situations that you have to take into consideration when you do your when you use the public health perspective. But how does it merge? How does it work together? And as your slide says, models of collaboration in medicine and public health. Okay, so you improve healthcare by coordinating services for individuals. You improve access to care by using frameworks to provide care for the uninsured, which we will see in your later lectures, how insurance would help or not help an individual. Improving the quality and cost effectiveness of care by applying a population perspective. Okay, for example, vaccination rollout. How cost effective would vaccinating the population would be in terms of your coronavirus? How much is the vaccine versus how much would be an individual or the government will be spending on an individual that will eventually get infected over vaccinating an individual. So you have to look at that. That is also why, is screening done for all diseases? No. What are the diseases that are ideally good to be screened? Or you have to establish a good screening program. For example, cervical cancer. Why is screening so much in place there in cervical cancer? As compared to ovarian cancer, where screening actually is not that established yet. Because if you intervene early in your cervical cancer, population perspective-wise, interventions are set into place, you can prevent or delay progress of cancer, thereby improving prognosis. Using clinical practice to identify and address community health problems, you will see trends. And of course, You have to report diseases of importance or notifiable diseases. And clinical practice would also be one of the first to detect if there's a problem. For example, the first case of measles in a long time, you alert. It was seen in a clinic and it was alerted, it was reported. Of course, you know that measles should be eradicated. Has been 0 cases for a long time, and then there's one. Of course, you notify the proper authorities. Health promotion and health protection by mobilizing community campaigns. So you go to the community or you use your community perspective to promote health promotion. Now, since we are in a quarantine or in lockdown status more often, our community has become online. So where do you see health education and health promotion? In your social media, in various websites. Please be part of it. Okay. I know there are a lot of websites that are not credible. Use your voice as a medical student. If you have a platform, educate people. Just educating one other person already is significant. Such that we shape the future direction of the health system by collaborating around policy, developing policy, furthering training, and being involved in research. Okay. So in the US, so Amendment 10, so powers in the US by the Constitution, nor prohibited by to the states, are reserved to the states or to the people. Okay. So which power? So we have police power. So this is sovereign power of the state. And one of its duties would be to provide for health, safety, and welfare. And this is to the local government, or in the US, federal government, in the Philippines, your national government. So governments would have formal structures. Ours is national. You have the state, and then you have your local government. For the Philippines, it's deregulated. So it is the local government which will have a say, the biggest say in providing health for the people. So the budget of the local hospital, the local government hospitals will be coming from the city government or from the provincial government. Although your Department of Health would be your umbrella organization under the national government, it will just help the local government implement policies. So an example, so there's a communicable disease declared. So what happens is there's a public health emergency declared. So that we prevent disease and further propagation of the disease. How does it work? Okay. So core functions of your public health would be to assess, to develop policy, and to provide assurance. Assess the situation, develop policies, and assure people that it's under control. So assess the situation of the pandemic, develop policies such as lockdown, and assure people that it is being controlled. For example, using the coronavirus as an example. There are 10 essential services of public health. These are the following. Okay. Assessment function. So collect, assemble, analyze, and distribute information on the community's health. Okay. We see that in our daily reports, how many of the coronavirus tested got positive, what kind of variant, how many are hospitalized, how many died. Okay. So information such as that is one of the roles of public health so that we could assess properly. Okay. So assessment is important because we can monitor the health status to identify problems, diagnose these problems and health hazards in the community, evaluate effectiveness, accessibility, and quality of our interventions and services. Okay. Policy development. So this function involves development of policies based upon scientific knowledge and decision making. So what's the basis of lockdown? What is the basis of lockdown such that most governments ended up imposing a policy of lockdown? What is it based on?
Doctor, the
Definitely.
whole,
Okay, who's that? Go ahead.
Doctor,
Want to answer?
yes, Doctor. Doctor, the whole thing behind lockdown, we can say is that the to stop this, as we know, we didn't have any information, but we knew it's a virus, right? So, for stopping the communicable spread of the virus, it was better if everybody stayed at home because around the world, if we allow the public to go out and open, then the spread of the communicable virus can be high. So that's why I think the whole initiative of lockdown was taken, because if people stay at home, then we can stop the spread of the virus.
It will delay or stop, prevent the
Exactly.
spread of the virus because the people are at home. You know how virus replicates, the virus would need a host, correct? And if this host could not infect someone else because it did not meet someone else, then the virus will not replicate. Hence the rationale of a lockdown. However, again, we will see later on, it's also it also should be balanced because we cannot be in a lockdown forever because there are other issues such as the economy. Some sectors should be kept running. For example, the health sector should be kept running to provide still essential health services. So that is the rationale of your lockdown. And that is brought about by policy based on scientific knowledge and decision making of the higher ups. Okay. So this policy aims to inform, educate, empower people about health issues, mobilize communities to identify, solve health problems, and develop policies, as mentioned, to support individual and community health efforts. Okay, so assessment, policy. Assurance then, so a set of personal and community-wide services determined by involving key policymakers and the public. So once we have this, these services be provided to all members of the community, either through encouraging actions by others or by direct provision. So assurance assures a competent public health and personal healthcare workforce. It also assures that laws and regulations be enforced so that we could protect health and ensure safety and provide linkages that people need for personal health services. Impacts, assessment, policy, and insurance. So research for new insights and innovative solutions to health problems. Okay. Some examples. So monitor health status to identify community health problems. Okay, we have our basic census, death certificates, birth certificates, immunization registries, surveillance, like what we are doing now with our coronavirus. Diagnose and investigate health problems and health hazards in the community. So examples would be outbreak investigations, child death review boards or your mortality morbidity, censuses. Inform, educate, and empower people about health issues. So you have your lead paint displays in hardware stores, new releases on rabies and West Nile virus. So any new information communicated. Mobilize community partnerships to identify and solve health problems. So you have your certain groups which would push for certain advocacies, your advisory boards, and the like. Policies support individual and community health efforts. So these are your smoking bans, helmet laws, restaurant inspection laws. Now it's the lockdown. Number of people only who could go to the restaurant, social distancing, etc. Those are all developed policies in response to the pandemic. Laws and regulations that protect health and ensure safety. Food inspection certificates, enforcement of smoking regulations, okay? Face shield, face mask. If not, you will get apprehended and the like. Link people to needed personal health services. So these are insurance programs, home for the aged, orphanages, etc., etc. Competent public health and personal health care workforce. This would be your continuing medical activities, such as your conferences, training programs, your journals, medical school, and the like. Evaluate effectiveness, accessibility, and quality of personal and population-based interventions. These are your outcome evaluations and economic analysis. So these are some examples. Research for new insights and innovative solutions to health problems. So providing research to look for solutions. So a lot is going on. So for example, recommendation for vaccination in pregnancy. When was it issued? Was it issued immediately?
No, doctor, it was not issued immediately.
No, why cannot we issue immediately a recommendation for pregnancy, for vaccination in pregnancy? Because research has to be done to make sure that your vaccines, the vaccines would not
Doctor,
cause any complication in the fetus. So it will take another 9 months. So after the vaccine was developed last year, after 9 months, they looked at people who got vaccinated without knowing they're pregnant. You know, your pregnants are pharmacological orphans. You cannot, and there's not a trial that would be that could be done or could be existent because that would be unethical. So those who just got vaccinated, didn't know they're pregnant, they looked at the results and they showed that there's no adverse outcome. Hence, recommendation that it is safe in pregnancy and it is recommended by the Obstetrics Society. Another example would be heart disease. Monitor health status to identify community health problems so that we could diagnose and investigate health problems and health hazards in the community. So you look at health status, heart disease, what do you look at? Weight, blood pressure, etc. And you look at the behavior, lifestyle of the people in the community, such that we could inform, educate, and empower people about this, mobilize the people to identify and solve their problems. Develop policies and plans. Okay, assure competent public health and personal health care workforce. So this is a summary already. Enforce laws and regulations. Link people. So these are the essential services. Evaluate effectiveness. Research for new insights. Okay. So for your assignment for this activity, so think about a current public health problem faced by you or the institution, and take that public health problem or issue and think about how the 10 essential services of public health can solve that problem. Okay. By group, okay, use your existing group for reporting. What I want is, of course, we are all clamoring to go back face to face in class. You know the institution, you know that we need face to face, etc. You know the issues. Look at the issue on how we could maintain safety upon resuming face-to-face classes in JFSM, and look at the 10 essential services that I've listed and list the solutions. Okay, or what could be done. Okay, for example, what are the initial steps that could be done before you go face to face? You have to have a negative PCR. How often will you do your PCR, etc.? Or for example, you know your BSLR or your 7th floor amphitheater. How many people would you allow face to face, etc.? What are the safety measures that could be done, and the like? Okay, so assignment to be submitted next week. Okay, so reporting would be next session, Indian health system and public health administration. Okay, and the other groups have also been assigned, so that you could be trained to do public health speaking. So that is part of the exercise. So it's try to involve as many as possible, not just limit to one. I am also not limiting you to plain reporting. You could do creative ways on how to introduce or how to go about your topic. Okay?
वो मछली खरीद रहे हैं, समझ में नहीं आ रहा है क्या बोल रहे हैं. बात देख, मछली तो देख ली.
Okay? Any questions for this afternoon? Okay. I allotted time for your reporting supposedly, but we'll have that next week upon your request. Any questions on the assignment and the reporting assignments? So
Doctor, in what format we have to submit the assignment next week, like in a Word file or a presentation? What format?
Just a Word file. This won't be presented, but it may be discussed next session. Do you want? We will see. We will just collate. We already have 2 reporters next week anyway.
Okay, doctor.
All right.
Thank you.
If there are no questions, you may leave this call.
Thank you, doctor.
Thank you, doctor.